bad news is like communicating वो तोता मर गया है. You know, most of us know that वो तोता कैसे मर गया है, because finally unless you communicate कि तोता मर गया है, वो राजा का बड़ा प्यारा तोता है, तो वो कैसा मरता है, तो नहीं वो हिल नहीं रहा, वो डुल नहीं रहा, वो खाना नहीं खा रहा, वो पानी नहीं पी रहा, kind of a thing. So finally what is required is how you communicate about the bad news, what a nucleus drop, not putting the IOL or anything. As everyone has said, right from KP and everyone has said, and what Dipti was saying, probably for me, hairs being already white, I think for me it's a cutting edge. So whenever I try to communicate, it is being accepted fairly well. So first and foremost is you have to be a good listener, as everybody has said that before, because see, before you break the bad news, patient is not directly on the table and with the complications on. Patient has already reached to your OPD. So it starts right at the front desk. So unless your front desk gives you a proper treatment, because one single small negativity would always give you a bad impression to the patient. So effectively, it is everybody from the front desk has to be a good listener, and that's the most important part of the success. And success is in terms of good work and good repute, both. It's not only in terms of money what you earn, it's all what you get as number of patients. I think number matters more. Money is automatically a byproduct of the whatever number of cases you see. So you have to be a soft spoken and gentle before you get it. As I said, that first visit, feeling getting connected is most important. Your front desk will always give the person a correct perspective. That banda aaya hai, you talk to the fellow and he would give you properly communicated everything, as he has said that the time required. He might have started from the home, there may be a traffic jam and n number of things happening, and he would be saying that I left 2 hours before. So instead of saying that way, you try to make the patient comfortable once he is inside, and once he enters your premises, it's everything is on your head. So it is your responsibility to communicate it properly. So you have to be a patient listener, avoid attending the phone call, as Dipti has correctly said, and focus on the patient's issue and do not think of the chair time. Because everybody thinks that chair time is the most important. 1 minute, 2 minute, 2 minute में 2 patient होना चाहिए. It's not the case. And counseling makes the main crux of the story. Get yourself trained into the reach out to the root cause of the complaint. And you are a preliminary and eye surgeon. You may be a retina fellow, you may be a squint fellow, but finally patient will come to you as an eye surgeon. He doesn't know that any kind of a loss of vision is because of retinal problem or refractive error or anything else. So you have to be very patient in listening. You cannot say, I remember one of my fellows saying, sir, mere paas glaucoma ka patient utna nahi aata hai. I am a glaucoma consultant. I said, but then unless a patient reaching you at the age of 40, he would come for the presbyopia correction. How can he understand that you are a glaucoma fellow? So you have to be considering yourself as a primary ophthalmologist, and then you are a retina fellow or a glaucoma or pediatric ophthalmologist, everything. So let the patient get confident in you and try to read the body language. So you have to get socialized with the patient about unless you are I am a small town practitioner, so your every action is judged by the society at large. For everything you communicate or whatever you do in the society is taken in a different stride at the smaller towns. It may not be for Quresh because he is in metropolitan city. So whatever Quresh does in between, I think it's a different story for Quresh. So every small habit of yours is considered properly. So you have to be very particular about presenting yourself in the society at large. And technical and commercial counseling, as I say always, you have to start. Technical counseling is a different thing and a commercial counseling is a different thing. As Dr. KP has correctly said that you have to give not a huge number of packages, 23. वो उतना बड़ा डोसा नहीं चाहिए. So you consolidate within as short as possible that you can, because everything it matters before you break the bad news. Because my standard way of counseling is that MH370, which has lost somewhere about 8 or 9 years back, is not yet found. Where people know कि aviation industry maintains the highest standards of the cross checks and checks everything. So whatever we do, 1% chance है कि मेरे दुनिया के सबसे अच्छे सर्जन के हाथ से भी कुछ भी हो सकता है. Anything can go wrong is the entry word for every counseling. So if you have a proper counseling, you can break the bad news properly. And you try to correct them through the job which they have been doing it. So whatever जो भी बंदा कुछ कर रहा है, as a teacher comes to me, I say कि तुम्हारे पास आने वाले 100 बच्चे हैं, you cannot assure that every person would go to medical or the engineering. There are people that who may not go for medical engineering because finally it's your job to train. But exam में तो उस बंदे को ही लिखना है. So effectively it is important to understand that you starting of the counseling is a starting of the breaking the bad news also. And as he has said, give the bird's eye view. न्यूक्लियस नीचे गिर गया, ये हुआ है, वो एवरीथिंग, वो जगह नहीं था, इज अ करेक्ट वर्ड व्हाट आई आल्सो यूज फॉर लास्ट मेनी मेनी इयर्स की वो जगह कम था, वो लेंस बैठा नहीं है, बट विल ट्राई टू डू इट एज अ सेकंड सिटिंग इफ द वीआर फेलो इज नॉट देयर अराउंड, ऑलवेज ऐसे कि वो सेकंड सिटिंग में बैठ जाएगा, एंड दैट्स अ स्टैंडर्ड एंट्री लेवल ऑफ द काउंसलिंग इवन फॉर एवरीथिंग बिफोर आई ब्रेक द बैड न्यूज, एंड encompassing all possible problems as I said, जो भी हो सकता है, एंडोप्थेल्मेंट भी कुछ भी हो सकता है, पूरा आग चला जाएगा, बट देन यू हैव टू कम्युनिकेट इट इन अ वे कि इन अ नटशेल, but at the same time be assertive and affirmative to say ki what is likely to happen. As I said, that guarded prognosis is one thing that you have to communicate it properly, and hyping out the unrealistic outcome, चश्मा ही नहीं लगेगा, the moment you say trifocal and anything and चश्मा ही नहीं लगेगा, and even if the fellow has a 6-8 vision, he has hundreds of grudges against you. So always make them understand that I am also more in favor of monofocals unless patient specifically asks for the multifocal. So, and it is always a patient's expectation that more amount is paid, there are more expectations. So try to cut down on their expectations right from the beginning, which will always help you to give the proper counseling for the further things if there are any complications. And getting confirm about the patient, the relatives, to understand the technical aspects of the problem, and transfer the patient for the commercial counseling to someone else, because then that is not your job. You are, because, but then I have always thought that technical part is to be told by the doctor as much as possible, and commercial you can leave to your counselor as he can do it. And as I said, the breaking on the bad news, giving the baseline idea at the correct time when the patient is in the most receiving way, as he has correctly said, कि बीच में बाहर आके between the two cases you come out and you tell everything that whatever has happened and we are trying our level best. But it's keeping your own calm is the most important thing. If your face shows that you are panic, I think it's gone. So you have to be keeping your face very calm and quiet, and as much as normal situation for yourself, which will ease out the patient's relative also. And immediate post-op is the best time. Dilute the story, but do not dilute it to that level that वो पूरा पानी बन जाए. So an optimum dilution is required, and certain things are left between the lines. But as I said, it has to be assertive and a meaningful thing. So effectively, yes, it can happen. It's not that bad. हो जाएगा, ऐसे कोई चिंता वाली बात नहीं. 2 दिन के बजाय 2 हफ्ता लग सकता है. And as I always say कि topical or whatever may be the case, always give at least 2-3 हफ्ता लगेगा. Because it is always expectation कि उसको तो कल से दिखने लगा है, मुझे 2 दिन एक्स्ट्रा क्यों लगा. And because nowadays everybody is in so much hurry कि everybody wants कि second day, or why second day, within 6 hours he wants everything going back to the normalcy. So it is important. Nowadays most of the patients are net gurus. So make them aware about the information, wisdom and knowledge. Tell them that what you get on the net is only information. You have to apply your own wisdom to convert that into your own knowledge. Otherwise, एक गाड़ी बनाना तो YouTube पे और इस पे भी मिल जाएगा, how the car is assembled. Even if you are given all the material available for required for the car, you cannot assemble the car as good as it is assembled in the factory. So I always make them understand at the part of counseling कि दुनिया का कोई भी डॉक्टर जो है वो भगवान की दी हुई जो गाड़ी है उसको मेंटेन रखता है. It cannot manufacture the car. So we are, that is part to before we go for the the breaking the bad news. Keeping anger under control and assertive communication is most important. I think with this I have absolutely much in time. Thanks a lot.
Thank you, Dr. Madhav, for really, getting the points right in time, and also the exact how to break the bad news